I'd like to invite to the podium Mark Merritt, President and CEO of the Pharmaceutical Care Management Association. Welcome, Mark.
Well, thank all of you for coming. Thanks, Diana. Thanks, Bob. Great presentations from Congressman Ryan and MacArthur. And I think you can see something that's important. And I'm going to be short. I'm not going to go into the usual fest of explaining all the wonderful things and technical things that our industry does and on this thing and so forth. But you can see that this is an issue that brings people together. And that's not really true of most healthcare issues. Healthcare issues, unfortunately, are rarely bipartisan. This one is different. And I think it's different because you're actually talking about health, and that's why it's so important to us. You're talking about real health. You're talking about 33,000 lives a year being lost to this. And so many of our healthcare debates are about important things, but things like financing of healthcare, of insurance coverage, and so forth. But this is really about life and death. And the good news about this, as serious as it is that there are real solutions to it. And we wanted to sponsor this event because we believe, even though this is not a front burner issue like some of the other big healthcare issues that we've seen dominating the news over the last couple of years, this is the single most important thing we can do to save lives in America with healthcare policy out of this town in Washington. This will really save lives. I mean, we have the big problem with opioid abuse is not just how to help those who already are addicted. The key is how do you stop that from happening in the first place? As members of Congress mentioned earlier, these are a lot of good people who go to surgeries, get otherwise start taking these drugs and then get hooked on them, no fault of their own, and all kinds of problems start from there. The key is how do you keep the drugs out of people's hands when they are at-risk patients? How do you prevent fraud? Because there's a lot of fraud with providers and different kinds of pharmacies that have big problems with this and so forth. How do you prevent doctor shopping? How do you prevent or identify when a patient's going to 15 different doctors to get the same script? How do you identify when a patient's going to 15 different drugstores within a matter of hours to get the same script filled or copying scripts? The way you do that is you use technology, and that's what electronic prescribing is. PBMs, pharmacy benefit managers, are so important to that because we manage all the prescription drug claims really in America. We see in real time who is taking what. We see when there are problems. We see when there are when there's at-risk behavior. We can see when somebody is going to different drugstores in the same day, to different doctors trying to get scripts. We can see all that. But without technology and electronic prescribing, there's no way to communicate that in real time for doctors. The goal is if a doctor has somebody come in, it would be nice before they prescribe opioids to see whether this is an at-risk person. Have there been addiction issues? Is there behavior the doctor at least needs to be concerned about? It doesn't mean the patient shouldn't get the medications that they need, but the doctor should know about that. And at the same end, the doctor should know what drugstore they're going to get these filled at. And the pharmacist should know that the person they're dealing with has some issues and should know if there's been any other problems with that. And so you can do all this through electronic prescribing. And the technology does something that nobody's been able to do on healthcare politics and policy before. It really brings everybody together. It brings the payers together, the insurers together, the PBMs, the doctors, the patients, of course, the drugstores, and they can all see what's happening in real time. Now, this particular legislation that passed initially in the House last night will be passed throughout the House later this week, is part of a continuum, the Every Prescription Conveyed Securely Act, because we started, the PBM industry, started 10 years ago and got a law passed to introduce incentives for physicians to use e-prescribing in Medicare. And we worked with John Rauter at AARP and a host of other groups to get this done. And back then it was great because it was a bipartisan issue then too. I mean, our lead sponsor was John Kerry, but one of our biggest, we all know John Kerry, but also you had people like Newt Gingrich, you had Republican senators, you had Democratic senators. It was an issue that everybody could get behind as soon as they understood it. And that got the ball rolling on this issue. But in the intervening years, a lot of the incentives got lost, the legislation, the regulations changed, so the physicians really didn't need to, they could still get the money without really using e-prescribing, and it kind of got watered down. This new law would require it in Medicare. It would require e-prescribing for controlled substances in Medicare. And right now, you only have about 15% of controlled substances being e-prescribed. This would change that dramatically. And the beauty of doing it in Medicare is, of course, you have the most drug utilization in the Medicare program, but that also leads the way for the commercial market. And we've seen this happening in the states already. 10 states have already passed legislation that require e-prescribing for controlled substances, and they're seeing great results. But leveraging technology is the key. Prevention, in our mind, is the key. And this issue is also, it really fits into this particular environment because it's the unusual healthcare issue that actually saves money. Requiring electronic prescribing in Medicare will save, according to the CBO, $250 million, so hundreds of millions of dollars over 10 years. You're actually saving lives and saving money. It's a win-win on every front, bipartisan and so forth. And now I know Congressman MacArthur said, hey, look, we don't want to get headlines on this, we want to get solutions. And I totally agree with him on it. But the reason we're doing this event is this issue needs some headlines, not for our sake or any politician's sake, but because people need to see this is a real solution to one of the two issues the president campaigned on drugs. Remember, there are two issues. It's not just price controls. That's one of the things that President Trump talked about. The other was opioids and the devastation in Iowa and New Hampshire, these rural states in particular, that the president really committed to do something on. This legislation is the single best solution to that, and it's something that Republicans and Democrats should really trumpet and really should make people aware of. Prevention, technology, and so forth is so important here. But we're hoping to increase awareness. This event is doing that. I really appreciate everybody here coming to this because you can then tell others about it. You're not going to read any headlines probably on the bill that passed last night. Jonathan Hayfetz, our lobbyist who put all this together, is doing his best to spread it all around. But we really hope that the press will focus on this. We hope that the press will see and tell people, and that everybody here will tell people, hey, there's a real solution to the opioids crisis. It's not a silver bullet solution, but it is a key prevention solution using technology that already exists. We already have it. We don't need to create anything. We're not guessing or trying to figure something out. This is technology that exists in the real world that we can use to save lives. So with that, I will stop and again say thank you all for coming, and I hope you get a lot out of this conference. Thanks.